Crime's been a big talking point of politicians nationwide. And here in Colorado, there are different strategies on how to lower the crime rate. One idea is to put more resources toward behavioral health services to help low-level offenders instead of incarcerating them. With that, here's Denver 7 political reporter Megan Lopez.
Busy doesn't even begin to describe Mary McKenzie's day.
We just had to close down referrals.
Mary is a behavioral health navigator for the mental health diversion program in Boulder County. Rather, she's the only dedicated navigator for that program. And between her 36 rotating clients, she's always busy.
I'm with them from the time of intake until the time of discharge after 6 months.
Mary's part of a pilot program in the county prompted by a 2018 law to try to reach low-level offenders early in the arrest process.
So they don't have to make a plea, they don't get sentenced, they're just diverted out of the system into community treatment.
Using diversion rather than a court division to get them help.
The faster we can kind of treat and recognize, then hopefully we don't see people getting deeper and deeper into the systems.
So far, Boulder says it's had a 91% success rate and some significant stories.
We had one man who had over 100 arrests in 2019. We were able to divert him into mental health diversion, and we were really happy to see that in 2020, he only had one arrest and none that I know of in 2021. He's now housed and stabilized.
So this session, a bipartisan group of lawmakers is working to make that pilot program permanent.
As part of the intake process in the jail, the bill provides that they are to be assessed. So this bill is designed to provide treatment rather than punishment.
But there are challenges. A report released last year on the program found 8, like mental health provider shortages.
If I don't have facilities or programs or people to staff those programs, it's not going to be as successful as it could be.
Parts of the report also called the program all carrot and no stick.
We don't threaten to file the charges later, but we do expect that they are going to work with us. The downside is that there are some people that might not come back.
So some defendants could get away without treatment or punishment. Still,
it's not just a carte blanche pretrial diversion program. Offenders have to qualify.
Supporters insist this program is a different approach after so many years of taking the same tactic.
If we can get people back on the right track, stabilized on their behavioral health issues, we're going to see less crime from them in the future.
Megan Lopez, Denver 7.
The bill passed its first committee last month. It heads to the Senate Appropriations next.